Hello, my project is called An Analysis of Adolescent Malnutrition on Oral Health, and it's a systematic review that we're exploring. And just to give you an introduction of our project, vitamin and mineral deficiencies are very common, and a lot of times these deficiencies can go unrecognized by the individual. The oral cavity is often one of the first sites that these deficiencies will make themselves known. So as dentists and orthodontists, it is critical that we are adequately trained in this field so that way we can better prepare our patients to get the help that they may need. For example, some of the hallmarks that we might find in their mouth of the B vitamin complex would be atrophic glossitis as well as cheilitis. That can give us signs that they need supplementation in that area. In anemia, erosive glossitis of the tongue can be seen. In vitamin K deficiency, petechiae can be seen. And we are studying this because there is limited research on this topic, and malnutrition can also affect the growth and development of adolescents outside of the mouth, such as stunting growth and affecting bones. So inadequate intake, like I mentioned, can have permanent implications leading to stunted growth, weakened immune system, and digestive issues. Within the oral cavity specifically, though, it can lead to malformed teeth, enamel hypoplasia, altered eruption time, and it can also alter the saliva composition, which can in turn lead to caries and make them more susceptible to caries. So our goal is to find the common patterns seen in these presentations and to identify the hallmarks so we can better serve our patients. We also want to see which of these deficiencies is most common in adolescents and how it affects their growth patterns as well. And having this knowledge is critical because it allows us to take a preventative philosophy instead of a corrective philosophy after it's identified. And we can help our patients make proper food choices, and if need be, we can refer them to a dietitian as well. So we did a literature review and we searched in PubMed, Dentistry and Oral Sciences, Source, Scopus, and Web of Science. We looked at peer-reviewed articles, and one of our criteria was that they had to be in English. They could be no older than 10 years old, and they had to contain information relevant to the impact of malnutrition. And we looked at 594 studies, and of those studies, we included nearly 80 of them. So there's a high correlation that we found between malnutrition, oral health, and development. And people who are overweight or underweight, stunted, or are vitamin deficient, so out of the norm, are higher at risk for experiencing these oral health complications. Some of these complications include recurrent aphthous stomatitis, which would be ulcers, pain in the mouth, impaired quality of life, making it painful to eat or drink, which can further exacerbate malnutrition. It can delay eruption of teeth, cause periodontal disease, and caries. Specifically, vitamin D is critical, so missing out on this essential nutrient will have serious consequences for proper growth and formation of teeth. And most notably, early childhood caries is a consequence that's seen in an overwhelming number of studies that we found. So it is the largest risk factor for malnutrition, and that further perpetuates the cycle. So some of the conclusions we gathered is this is one of the first to explore the relationship between malnutrition, oral health, and the development of adolescence. And we found that there is a strong correlation that suggests that these deficiencies are associated with suboptimal oral health in adolescents. And while there are many risk factors, educating mothers who are the primary providers that are going to be feeding their children and buying them food, educating them is critical into setting the child up for the best health outcomes possible, and it's also essential for increasing access to more nutritious foods. Thank you so much for listening, and stay tuned for further developments. Thank you.